Hi everyone, it's Lorelei here. Welcome back to my channel with up-to-date news and valuable information on mental health. If you are new to my channel and you find the videos that are posted helpful, don't forget to hit the like button down below. Let's get started with the second installment of some interesting news for this week. Electrodes zap away depression in landmark study. Deep brain stimulation could represent a breakthrough in the treatment of mental health disorders like major depressive disorder. Scientists have successfully treated major depressive disorder with a brain pacemaker that was customized for one woman's brain. When electrical patterns in one area of the brain indicate depression, a gentle electrical charge stimulates another part of her brain to quiet them. The device has transformed the patient's life in the 15 months since its implantation, though it began working immediately. In breakthrough research, physicians at the University of California, San Francisco, have for the first time successfully treated a patient's severe depression by electrically stimulating parts of her brain. The 36-year-old patient, given the name Sarah in the study, described herself as someone whose depression was so severe and omnipresent that she was getting close to giving up on life. The treatment changed everything. Although she still experiences depressive symptoms occasionally, the device quickly dissipates them. For decades, neuroscientists have been experimenting with using deep brain stimulation to treat neurological disorders like Parkinson's disease and epilepsy. The minimally invasive procedure involves implanting electrodes into certain parts of the brain. The electrodes emit impulses that help correct problematic brain activity. This technique can effectively treat some neurological conditions, but its therapeutic potential for psychiatric disorders like major depressive disorder has been far less clear. The device implanted in Sarah's brain in June 2020, a sort of brain pacemaker, automatically takes care of two tasks, requiring no outside intervention. First, it monitors Sarah's brain for telltale depression activity in the amygdala. If the pattern is detected, the device briefly stimulates the ventral capsule and/or the ventral striatum target with a gentle 6-second 1 milliamp electrical charge. Because the device emits stimulation based on the patient's own psychological activity, it is called a closed-loop system. Sarah's depressive state was resolved almost immediately. After 15 months, the device was still providing therapeutic effects that have radically improved the quality of Sarah's life. The FDA allowed the scientists an investigational device exemption to perform the procedure. The team's success with Sarah show only that the device was capable of treating her specific constellation of depressive symptoms. To demonstrate the generalizability of the approach, the researchers are working with 2 more patients and hoping to add another 9 people with depression to their cohort. They're aiming to understand to what extent and how the biomarkers and the therapeutic target areas vary among different people. Kindness of strangers propels the BC cyclist on journey to raise funds for mental health. A Revelstoke, BC resident, Mikey Friedland, had no idea what was in store for him when he decided to go on a bike ride to raise funds and awareness for mental health. "I didn't have any training," said the 23-year-old. "I planned this about 3 weeks before I started, and I learned as I went." Friedland cycled for 50 long days on his Ride, Don't Hide for the North campaign, traveling more than 4,000 kilometers over the summer from the Canada-US border in Osoyoos, BC, to Tuktoyaktuk, a hamlet in the Inuit region of the Northwest Territories. He overcame inclement weather, rock slides, and treacherous highways while fleeing bears and mosquitoes. In the end, he raised more than $30,000 for the Canadian Mental Health Association, but the cyclist maintains he didn't do it alone. Friedland had no car following him to ensure his safety and said passing motorists would sometimes pull over and give him roadside meals or snacks. Others offered up their cabins for him to sleep in. I had help from dozens of strangers, including Canadians from all backgrounds. It's those personal connections and acts of kindness that surprised Friedland even more than the perils he faced on the road. He said the gestures and the handfuls of little personal victories made the journey very meaningful. It's something I'm trying to take into my life off the bicycle, he explained. Create these moments where I can get that satisfaction, get that feeling of accomplishment and self-worth. Friedland said he was motivated to ride for mental health after facing his own struggles during the COVID-19 pandemic. Safely at home in Revelstoke, Friedland is still collecting funds for the Canadian Mental Health Association and sharing his journey on YouTube. All funds raised will be split between the organization's branches in the Shuswap and Revelstoke area of northern BC and the Yukon. Twofold crisis, regional Australia housing shortage, compounding poor mental health. The housing crisis and mental health crisis are converging in regional Australia as rental vacancy rates in some regions fall below 1%, with city people on the move, rentals converting to Airbnbs or owners cashing in on high property prices. Regional towns have experienced a significant reduction in available properties and rental affordability, particularly since the onset of the pandemic. While the Sydney Central Business District, or CBD, currently has a vacancy rate above 7%, and Melbourne CBD above 5%. The vacancy rates across regional Australia, including regional Queensland, the Blue Mountains in New South Wales and Southwest Wales, are less than 1%. SQM Research, a financial institution in North Sydney, has showed. Louis Christopher, managing director of SQM, said that this had been accompanied by a dramatic increase in rental and housing prices over the past 12 months, with areas such as the New South Wales North Coast seeing a combined rental price increase of 18.6%. That's a huge increase in rent. On our series, we've never recorded such an acceleration in rent in regional Australia, Christopher said. Ellen Jones, a solicitor in the New South Wales town of Orange, said like all regional centres, her hometown had a divide between rich and poor, but the housing demand for both sales and rentals has increased the divide markedly. This used to be a rural backwater that people couldn't wait to get out of, she said. Now is the fashionable place to be, with Sydney people visiting on 2-degree days when it's sleeting, saying, "Isn't it lovely and wintry?" which is excellent for businesses, and we have a younger population coming in. She has had clients buy $450,000 houses 4 years ago that are now selling for $1.1 million, and the demand is causing a boom in renovations. Low-income housing options that were released for $150,000 are now $450,000, a price that those on lower incomes or the unemployed cannot possibly afford. At the same time, she deals with separating couples who are forced to stay under the same roof with children because one partner cannot get rental accommodation. Jones described the immediate separation phase as the most dangerous period for women and really bad for children. If something doesn't change, we are going to see single moms sleeping under bridges. I've seen people with children, and even more so if they have pets who cannot get rental accommodation, said Jones. If the market is tight, owners want to offer properties to singles or professional couples, and people are paying over the market rentals. The Queensland Alliance for Mental Health, or QAMH, the state's peak body for community mental health, said the situation was pushing people experiencing mental distress into homelessness. The QAMH has also called for a boost for social housing with integrated mental health support from the Queensland government. Karen Bonham, a community development coordinator at the not-for-profit Mackay community organization MADOC, said anyone with disadvantage, even those on moderate incomes, just don't have a chance. There is a visible increase in the number of people who are having to find alternative sleeping arrangements in cars, in car parks, and that includes young families with children, in the local parks, behind our town hall, anywhere that's vacant, out of the weather, Bonham said. Bonham said the lack of housing support creates a perpetual cycle of mental ill health, as there's an all-around bottleneck where there's no exit strategy from crisis accommodation services into more independent accommodation options. Toronto Police temporarily suspending program for officers meant to assist on mental health calls. Amid increased public scrutiny for how law enforcement handles calls for people in the throes of a mental health crisis, Toronto Police officials have temporarily suspended the specialized deployment of some officers who are trained to assist on these kinds of calls. Now experts are questioning why this program exists in the first place, arguing resources would be better served funneled into community health organizations to respond to these situations instead of police. According to an internal memo obtained by CBC News, Toronto Police temporarily suspended the deployment of what it calls Divisional Crisis Support Officers, or DCSO, in September, citing staffing pressures. The intention of the program was to have these officers who completed specialized training from a 2-day course assist with Mobile Crisis Intervention Team, which pairs an officer who completed a 10-day course with registered nurses to respond to mental health calls. The intention was to have the DCSO officers primarily assigned to that effort and not available for other calls for service. But now, according to the letter, these officers are expected to be available for any emergency calls. While not being dedicated to this role when available, it is expected that these officers continue to utilize their valuable skill set when attending calls and assisting members of the public. The memo reads, adding that the intent is to return to the original program deployment model as soon as staffing allows. Documents from the September 27th meeting of the Toronto Police Services Board state that the DCSO program was introduced for frontline officers in 2021, with 149 officers having received the training and 131 more scheduled to receive it by the end of this year. In an email to CBC News, police spokesperson Megan Gray said that as the force prioritizes staffing in primary response units, or PRU, in the city, the work of the DCSO has been reimagined. Specifically, instead of having only one dedicated police officer on each shift, we are training more PRU officers in order for them to be better prepared to respond to mental health calls for service, Gray said. John Sewell, coordinator of the Toronto Police Accountability Coalition and a former mayor of Toronto, told CBC News in an interview that if anything, this issue suggests that police are responding to calls they shouldn't have to, which could instead be handled by mental health workers. Why are police responding to homelessness calls? Why are they responding to drug overdose calls? They aren't needed for those kinds of things, he said. The point is, police are not trained in mental health. The city will soon try out one of the models with a new pilot program employing crisis workers with expertise in mental health and de-escalation set to replace Toronto Police as the first responders for certain non-emergency 911 calls starting in 2022. Police officers are essential. They are skilled at what they do in their job. but they're not health providers, they're not mental health experts, and they are not equipped with training or not to address mental health crisis safely in the community. Sergio Poulos said, if there is a particular video or a piece of news that I have posted on my channel and you would like to comment on it, please feel free to do so. Also, if you know of anyone who is going through a difficult time and is in need of help or support, I am here for them. Just email me at dynamicsinhealing@gmail.com and I will respond within 12 hours. Thank you so much for watching this part of the news for this week. And again, take care, and I'll talk to you real soon again. Bye.